So how did we do that? Preparation and the undeniable collective power of 22,000 nurses we brought to the table when we issued a 10-day strike notice. Coming out of the worst pandemic of our lives, having health and safety language is a priority for all of us, especially after experiencing Kaiser's careless attitudes towards our lives and our patients' lives. In the first months of 2020, Kaiser management told our nurses if we brought our own mask to work, that we could be fired. They tried to force us to reuse N95 masks for days. They failed to screen and test patients. They did not do essential contact tracing. And when it came to exposure notification, they were either late or completely negligent. Kaiser nurses filed dozens of Cal OSHA complaints, resulting in over $500,000 of fines for Kaiser. Because of these health and safety failures, our nurses got sick. And then we were told we got it outside of the hospital, so it wasn't covered by workers' comp. And some of our nurses died. We knew going into this contract negotiations, this had to change. So our campaign began a full year before our contract expired. We organized nurses union statewide against Kaiser's new disastrous Home All Alone plan, where they send acute care patients back home with remote monitoring without 24/7 nursing care. Building toward a statewide picket allowed us to push back on this corporate nightmare while also showing Kaiser we were prepared, we were organized, and we were very angry. When negotiations began the next year, we built a campaign escalation plan. We were used to these types of fights, fighting Kaiser for decades and winning. But this was different. We escalated much quicker than the previous years. So this required our nurse leaders and activists to communicate, coordinate, and build solidarity like never before. After every bargaining session, our bargaining team members met with our facility bargaining committees to get ahead of Kaiser's messaging and also to begin our next escalation tactic. We started with bargaining surveys and then sticker-ups, marches on the boss, leafleting our patients, and an info picket on the day our contract expired, telling the press and the public how Kaiser treated us and our patients, that we were expendable. By the time we issued a 10-day notice to strike with 22,000 Kaiser nurses, Kaiser was terrified, as they should be. A few days before the strike was going to start, Kaiser caved and we won. So Kaiser nurses won health and safety language that includes PPE stockpiles, the same PPE standard for suspected and not just confirmed cases, and training and education. In the event of an infectious disease outbreak, Kaiser must screen patients, and they must provide engineering controls to stop the spread of infection. They have to do contact tracing. They have to provide nurses with testing. And most of all, they have to add additional staff and reduce assignments. But most importantly, we won presumptive eligibility. Meaning, if one of our nurses gets the same infectious disease, it's presumed that they got it at work. So we are so proud of what we won. We know We had to force Kaiser to sign this contract for these improvements, and that they only signed our contract because they were afraid of our strike power. This new contract doesn't expire until 2026, but we're not waiting until then to get organized. Even now, we're continuing to prepare by enforcing our contract and building nurse leadership and solidarity. So the moral of the story, when we fight, we win. Thank you.
Wow, looking out at all of you, I can feel the power in the room. This conversation, this convention, celebrating CNA's 120th anniversary is the perfect occasion to reflect on our shared struggles and collective victories, not just during these times of crisis, but throughout our union's proud history. Just to name a few of our militant milestones. We know our union was the first to represent nurses in collective bargaining agreements in 1946. One of the first nurses unions to strike in 1969. And in 1999, we made history with the first nurse-to-patient ratios law here in California. Our long legacy of advocacy through collective action laid the foundation for our power in the present. Because of decades of tireless organizing and strategic power building across the healthcare industry, always partnering with our patients and the communities, never the employers, we were prepared to spring into action to protect nurses when COVID hit and keep advancing our fights for workplace democracy and health, social, and economic justice in these challenging times. In just a moment, we're going to hear inspiring stories from an amazing panel of nurse leaders from across the country. Koki Gals, President and CNA NNOC member from Bangor, Maine. Michelle Vo, incoming President of CNA NNOC from Fremont, California. Brenda Langford, a newly elected CNA NNOC board member from Chicago, Illinois. And Perry Wilson, a ranking file leader from Asheville, North Carolina. But first, I want to set the stage by mentioning just a few of the gains our union has made since our last in-person convention. Since the start of the pandemic, we have held more than 6,000 actions across the country, from our workplaces to the steps of the White House. And we have won many victories, from mandatory PPE stockpiles and safe staffing in our facilities to the historic emergency temporary standard on COVID-19 that we forced OSHA to deliver. And throughout, we have continued to win at the bargaining table, settling industry-leading contracts covering over 100,000 CNA NNOC members. Because our escalating collective action campaigns, we won a significant improvement on health and safety, staffing, wages, and benefits. At the University of California and other major systems, we won groundbreaking diversity, equity, and inclusion language to address systemic racism in healthcare. At Dignity Health Common Spirit, we won language recognizing healthcare as a human right.